Hello and welcome. Mary here to talk about hypothyroidism for our Herbal Therapeutics assignment. I'm going to try to squeeze all this info in. I chose to look at hypothyroidism because of its prevalence in Canada. 2 out of 10 Canadians will be diagnosed with hypothyroidism in their lifespan. Risk increases with age and in female demographics. So hypothyroidism refers to the condition where the thyroid does not make enough thyroid hormone to meet the body's needs, or thyroid hormone metabolism is impaired, and we'll talk about that more shortly. Sufficient levels of thyroid hormone are needed for numerous hormonal and metabolic processes. Thyroid hormones directly act on the brain, the digestive tract, the cardiovascular system. They impact red blood cell metabolism, gallbladder, and liver function. And thyroid hormones are also involved in the production of steroid hormones, glucose, lipid, protein, cholesterol, metabolism, regulation of body temperature. Hypothyroidism can affect weight, mood, cognition, sleep, and menstrual regularities. Symptoms include profound fatigue, weakness, cold intolerance. There can be weight gain, dry skin, decreased heart rate, or hypotension as well, hair loss. Long-term undertreated hypothyroidism also puts individuals at risk for increased risk for osteoporosis, menstrual irregularities, reproductive cancers, and heart diseases. Primary hypothyroidism. It's the most common diagnosed form of hypothyroidism. It's most frequently associated with nutrient deficiency or autoimmunity. From a nutrient deficiency perspective, this refers to an endemic iodine nutrient deficiency. In Ontario, the upper Midwest and Great Lakes regions, we've been referred to as the goiter belt region because of the severely low levels of iodine in our soil, leading to hypothyroidism. Iodine was added to table salt in the late 40s. However, deficiency remains important to consider when working with clients in these regions. The most frequent cause of primary hypothyroidism outside of iodine deficiency is related to autoimmunity or autoimmune thyroiditis, also called Hashimoto's thyroiditis. And this refers to an autoimmune response. When stimulated, it forms antibodies that bind to the thyroid hormone receptors and progressively inhibit the manufacture of sufficient levels of thyroid hormone. And these same antibodies can bind to other sites in the body, we are learning. There's some recent literature that explores the role of fluoride exposure, such as found in municipal tap water, in the development of Hashimoto's thyroiditis. There is also some research exploring celiac condition and linking this to Hashimoto's. Secondary causes of hypothyroidism include pituitary hypothalamic tumors or treatments for such, radiation or surgery. Other causes: head trauma, metastases, infection, iodine radiation therapy, or ablation treatments for hypothyroidism. Subclinical hypothyroidism, important to mention here, refers to when a thyroid stimulating hormone is elevated and the free thyroxine levels, or T4, are within normal limits. This is actually quite common. Clients may or may not present symptomatically, and subclinical hypothyroidism is found to become clinically significant hypothyroidism if not addressed. Regular monitoring, timely identification, and appropriate treatment can make hypothyroidism a well-managed condition. However, clinical primary hypothyroidism will require medication management for life. Let's talk about assessment. A thorough case history is important when assessing for hypothyroidism, and serological testing is imperative, ideally at least every 6 months or with medication changes. Blood work includes serum thyroid stimulating hormone, or TSH, a free T4, T3, which is the most active form of thyroid hormone, and thyroid globulins and antithyroid peroxidase antibodies. This elevations in this will indicate Hashimoto's condition. So a thyroid panel is an important piece in the assessment process. However, interesting to note, some people with a Hashimoto's condition may or may not have the inflammatory markers. Other physical exams include vital signs, taking a blood pressure, heart rate, and body temperature, conducting deep tendon reflex exams to assess for hypoactivity, looking for presence of goiter, cool, dry skin with a thickened appearance. It's especially important to screen maternal clients because there is fetal risk with untreated maternal hypothyroidism. From a biomedical approach, hypothyroidism is treated with synthetic hormone replacement. T4, levothyroxine or Synthroid medication is by far the most commonly prescribed. It's very easy to regulate. However, some don't absorb T4 very well. Cytomel is another drug on the market. It is a synthetic T3, very potent, more difficult to manage with a narrower therapeutic range, so it's a less popular choice. There's a combo drug, a combo T4, T3 drug on the market called Thyrolar. And then there's desiccated thyroid hormone, which is sourced from porcine or bovine sources, and it's used when synthetic medications have not been metabolized well. Some people do well on the desiccated thyroid that have not responded to synthetic hormone replacement. There is not evidence to support a solely botanical approach to treating hypothyroidism. However, herbs can offer great support alongside conventional thyroid replacement therapy where appropriate. Primary approaches from a herbal perspective include improving metabolic function, addressing depletion, nourishing the endocrine system, and addressing symptomatic complaints such as constipation, dry skin, and fatigue, etc. Some of the herbal actions include adaptogens, mineral and iodine-rich nutritive herbs, adrenal tonics, immunomodulating herbs, demulcents, astringents, nervine tonics, and anti-inflammatory herbs. Hepatic and lymphatic support may be indicated to address low metabolic function experienced by some hypothyroid clients. My herbal protocol that I put together for this assignment includes Laminaria digitata, which is brown seaweed. It's a thyroid stimulant. It's a source of iodine and minerals. It's nutritive and demulcent. I also put Fucus vesiculosis, bladderwrack, in this tincture combination. It's a thyroid stimulant, again, a source of iodine and minerals. It's nutritive and demulcent. Withania somnifera, ashwagandha, has adaptogenic properties. It's an adrenal tonic. It's an immunomodulator. It's a nervine tonic and well supports the thyroid. I put some Juglans nigra, black walnut, which is antibacterial, antifungal, anti-inflammatory, astringent, and iodine-rich. And then I added some Ganoderma lucidum or reishi for its adaptogenic and immunomodulating properties. Some antidepressant herbs such as Hypericum perforatum or St. John's wort or Artemisia vulgaris, mugwort, could also be considered. When I was reading in the literature, these are often added to hypothyroid formulas. Rumix crispus or yellow dot could be used to help move the bowels if there's constipation. Nervine tonics can also be helpful, but nothing too sedating. From a nutritional standpoint, increasing kelp and seaweeds and natural sources of iodine and iodine-rich foods, including fish, shellfish, iodized salt, and yogurt, are options. Brazil nuts contain high amounts of bioavailable selenium. Selenium is a cofactor required to convert T4, the inactive form of thyroid hormone, into T3, which is the active form of thyroid hormone. Important to try to supplement that. Decreasing known goitrogens. These are the brassica family, cassava root, peanuts, soybeans, millet. Eliminating inflammatory foods and sources of inflammation such as caffeine, alcohol, processed sugar are all important. And avoiding low-carb diets, as these can decrease thyroid function. As with anything, taking individual client needs into consideration is important when it comes to diet. There are iodine supplements available. It's important to be assessing and doing regular serology to make sure that the body is not taking in too much iodine, which can actually make the thyroid less effective. Thyroid function. Other supplements, zinc is required for the synthesis of thyroid hormone and can be very helpful to supplement up to 30 milligrams a day. Pairs really nicely in appropriate ratio to copper for absorption. And selenium, as I spoke about, supplementing up to 55 micrograms is advised. Can have some Brazil nuts in place of, so that there's a food source of this if possible. Additionally, vitamins A, C, D, and E are helpful. A great quality wild Norwegian cod oil could also be considered. Lifestyle considerations. I'm wrapping up. I'm sorry, this is so long. Examining sources of lifestyle stress is important because the physical, psychological, and environmental stressors all impact our hormonal health and our thyroid function. Committing to daily exercise, which stimulates the thyroid, metabolic function, and tissue sensitivity to thyroid hormone is recommended, and addressing gut imbalances and infections such as H. pylori, parasites, working through a gut healing protocol are all important for several reasons. With a hypothyroid protocol, there is a specific gut bacteria that assist in converting T4 into T3, and a large portion of our immune system resides in the gut and regulates inflammatory response, which may contribute to Hashimoto's thyroiditis. So some complementary approaches include stress management tools, meditation, yoga, massage, acupuncture. There is some developing research into the use of red light therapy to reduce inflammation and improve outcomes for those with hypothyroidism related to autoimmunity. Thank you for sticking it out with me. I hope you have a great day.